Thank you.
I'm Helen. As a member of the Socialist Alliance and the Stop the War Coalition, I've met a couple of Iraq War veterans who say that marijuana is the only drug that is effective in dealing with their post-traumatic stress disorder. I've also heard, and this may be mumbo jumbo, but I've read that medical marijuana can shrink cancerous tumours. And I wonder if Alex could comment on those two issues.
Basically, in medicine, we have learned over the years to be much more rigorous about evidence and really require serious evidence before we say something works or doesn't work. And we look at three things: effectiveness, safety, and increasingly also cost effectiveness. Post-traumatic stress disorder is not one of the conditions that is considered to have cast iron proof of effectiveness in terms of medicinal cannabis. There is some question about MDMA, ecstasy, being useful for that condition. And indeed the United States has, government has approved a trial of MDMA for post-traumatic stress disorder in American military veterans. One of the problems here is that we do very little research on medicinal cannabis, not just in Australia, but even more so in the United States. Every possible obstacle is put in the way of somebody who wants to find or is prepared to evaluate medicinal cannabis to see whether it has got some real benefits. It's very difficult to get, if not impossible, to get funding. It's very difficult, if not impossible, to get suppliers of medicinal cannabis and to go through all the regulatory hoops that need to be gone through. So we haven't done anywhere near as much research as we should have done on medicinal cannabis, not just in Australia, especially in the United States. The US government is determined to stop research on medicinal cannabis. It still classifies cannabis in Schedule 1 in their system, which means no medicinal benefits whatsoever. That's the current state of play. And the United States government has a section called the National Institute of Drug Abuse, which is a scientific and funding body for doing research on illicit drugs. It funds 80% of the research on illicit drugs around the world, so it's incredibly influential, not just within but outside the United States as well. And a spokesperson for that agency a few years ago said in the New York Times that we fund studies that will make marijuana look bad. We don't fund studies that might make marijuana look good. So the questioner might be right. But we just simply haven't done enough research to tell a lot of these things, and now the public is really demanding it.
Quite some years ago now, there was a very successful anti-smoking campaign, and I'm wondering, are there any lessons that can be learned from that?
Very good question, and tobacco is really a poster child in the alcohol and drug field where we can get things right. It took a long time. It's over 60 years now, 61 years since the first paper came out that credibly nailed tobacco smoking for the very harmful habit that we now know that it is. It wasn't really until 1962 in the UK that this evidence was gathered together, 64 in the US, and then it took another 10 years or so before political mobilisation started to try and get on top of this terrible scourge. And it's taken, 4 decades since then for us to start bringing tobacco smoking prevalence down to the low levels that we see in Australia, and it's still falling. It's not been through any one particular thing, it's not just through education, it's been raising the price, banning smoking in certain areas, certain public areas, changing people's attitudes through advertising campaigns, making it easier for people to quit smoking. So there have been a lot of activities, and in combination they really work extremely well. And I think this has got important lessons for alcohol. If we can do that for tobacco, despite all the differences, we should be able to make better progress with making alcohol less of a problem in our community than it is today. And I think also it should inspire hope in us that if we could regulate some of the illegal drugs in a similar way that we're regulating alcohol and tobacco, we could maybe get a better handle on those drugs and keep them especially out of the hands of young people. And one of the advantages of taxing and regulating cannabis is that it allows us to do that. We can demand proof of age on purchasing, which won't 100% prevent young people from taking up cannabis, but it'll make it a lot more difficult for them. Smaller numbers will use cannabis underage, I think, once the drug has been taxed and regulated. So smoking is a very important lessons for us. And I think one of the other important lessons about smoking is that, and also alcohol, is the pernicious effects of what happens when the alcohol and tobacco industries are allowed to pervert the political process by donations. So I think it's very important that when we do get around to taxing and regulating drugs, that we find some effective way to make sure that political parties and individual politicians can't be corrupted by donations from these legal industries.
I think there are very clear lessons to be learned, and those lessons can be applied if we do go down the path of a regulatory regime. There are some proposals in the second Australia 21 report from Professor David Pennington, who will be known, I think, to some people here, particularly for managing the supply of cannabis. And those, there is no silver bullet, there is no just simple solution to any of this. It has to be multifaceted. There has to be a broad approach of the kind which has been enormously successful in relation to tobacco. The figures, I think, show that something like 13,000 Australians die every year from tobacco-caused or nicotine-caused disease. Hopefully, over time, those figures are falling. And it's only because of this very long campaign, which could be woven into a regulation of other drugs.
My name is Brian Forster. At age 27, in 1969, I was introduced to cannabis resin, or hash, in London, where I live then. And subsequently got introduced to LSD, Dexedrine, and very rarely things like cocaine. And I never tried heroin. One thing I've learned since that time, and I came to Australia and lived in Lismore, which is an area where there is plenty of marijuana available. In all the years that I practiced, and by the way, now I only have a glass of wine or beer, that's once a day. But in all those years, it became apparent that it was the vested interests in making the money out of providing these drugs, and it's their interest in keeping it illegal. Now, how do we, even politically, people in politics are involved in it, the judiciary, the police force, we know all of the different agencies. How do we actually get those to say, right, we're going to make this decision and we're going to look at a different form of legislation?
Well, I don't take the view that it's impossible. I take the view that it's difficult, but it is certainly possible. And indeed, a lot of things that people have said would never happen, ever, have happened. When my colleagues and I started working on trying to get a needle syringe program to happen in Australia in the 1980s to control the spread of HIV among and from people who inject drugs. We were told it's never going to happen. Do something that's worthwhile. Well, it did happen. When we worked hard to get a medically supervised injecting centre established in King's Cross, we were told it'll never happen, go away. But it did happen. We had to put in a ridiculous amount of work, and in both cases we had to break the law, civil disobedience. So I don't take the view that things are impossible. I often quote Herb Stein, who was the economics advisor to President Richard Nixon. Nick mentioned a little bit earlier. And Herb Stein used to say, things that can't go on forever don't. And I think this is one of those things that can't go on forever. We can speculate about why the law is so difficult to change, and I suspect that you're partly right. I suspect that that people who work in customs, police, courts and prisons don't want to see the law changed. The government officials who work in departments related to those activities don't want to see the law changed. And the ministers don't want to see the law changed because they've got their fiefdoms to protect. And certainly the people who run private prisons around the world don't want to see the law changed. And the people who run laboratories where urine samples get tested don't want to see the law changed. So you can add up a list that gets longer and longer the more you think about it. Is that the whole reason? I don't think so. I think it's also partly the nature of the political process itself. It's much better it's much easier for politicians to appeal to our fears and to our darker side than it is to appeal to the angels among us. And we're seeing that these days with another issue that's before the High Court, I believe. So how do we go about getting change? Well, change does happen, and it happens more if people like us write letters to the editor of our newspapers, metropolitan newspapers, suburban newspapers, rural, remote newspapers. If we write to our members of parliament, state and federal, if we ask our members of parliament to see a small delegation and express these views to them. It happens if we make our views known by arranging to speak at Rotary Apex Lions clubs, speak at politics in the pub. So getting the word out, getting conversations to happen, I think does change the world. It's not fast, but at least it's changed in the right direction. And there has been very significant change in attitudes in Australia. We now have a majority of Australians supporting the needle syringe program and supporting other harm reduction endeavours. 52% of Australians in 2010 support medically supervised injecting centres. This is 52% of all Australians, not just in New South Wales. So I think change is much more possible. If we look at the United States, in 1969, 12% of Americans responded yes to the question, do you support the legalisation of marijuana? 12% in 1969. In 2013, that figure was 58%. So it went from 12% to 58%. Took a long time, but in the last 10, 15 years, the increase in support for legalisation of marijuana in the United States has been very dramatic. And that's the Gallup poll, if you want to look it up. So change is definitely possible, but it requires all of us to put some effort into making sure that things change. Nick, I'll ask you to comment on that because a lot of this depends on legal matters that are beyond me.
Well, it's not so much legal, it's more political. It's propelled by the democratic process. And so what can you do as an individual? You can talk to people. You can express your views. You can do research into the issues if you like. Find out for yourself what the facts are, what the arguments are, what the competing interests are, and talk to other people. Write letters to people. As Alex says, write to your elected representatives at all levels of government. Keep the pressure on. You just never know when something you say to somebody or a letter that you send to somebody makes a difference. strikes a chord with somebody else and is then carried on through the community. You never know, but it's not going to happen unless you take that first step and talk about it. Have a conversation, examine the issues, form your own views, which may not be the same as ours, but do that and then talk to other people about it.
Can I just add one other thing? I mentioned this to Nick a few minutes ago. There's a wonderful book that I read that I recommend you might look up and get a copy of and read it. It's by a guy called Douglas Hussack, H-U-S-A-K, Douglas Hussack, H-U-S-A-K, and it's called, terrible title, it's called Legalises the Case for Decriminalising Drugs. I'm sure he didn't write the title. He's the professor of philosophy at law at Rutgers University, and his basic argument, if I can summarise the book in 20 words, is to say, does prohibition work? It's an important question, but it's not the most important question. Are there better ways of managing drugs apart from prohibition? Important, but not the most important question. To Douglas Hussack, the most important question is whether drug laws are fair and just. And I think the more I think about it, he takes a book to argue that case, and he makes a very strong case for saying that they're not fair and just. And would we want laws that work if we were convinced that they were unfair and unjust? I don't think any of us would if we were convinced they were unfair and unjust. And I'll just very quickly tell you one little example of an unfair and unjust law. In 1895, Oscar Wilde got a 2-year prison sentence with hard labour for having sex with another man. Now, I don't think anybody in this room would consider that anything other than totally barbaric. In 1952, another individual came before the courts in England for having sex with another man. And this man was responsible for an invention that everybody in this room uses every day, the computer. Alan Turing, correct. And he was responsible for cracking the Nazi codes. And so he made a huge contribution to the Allies winning the Second World War. And in 1952, he was convicted of having sex with another man. He was given the choice of having a feminising hormone or going to jail. He took the feminising hormone, and then 6 months later he put some cyanide in an apple and ate the apple and committed suicide. Now, was that fair and just? And what's the difference between the majority of us who prefer having sex in a particular way, punishing people who prefer to have sex with a consenting adult in a different way? And if you think about that, what's the difference between that when it relates to sex and when it relates to drugs? There is no difference. So I'll put it to you that the laws we have today don't work and are unfair and unjust.
Des Griffin, I first wanted to thank you both for truly outstanding talks, truly wonderful. My short question is, how much do we know about the extent to which the financial industry and other people dealing with large sums of money are in fact benefiting from the war on drugs, from the laundering of profits, and so on and so forth?
Start casino.
We know a fair bit about that. The UN system estimated that the annual turnover of illicit drugs at the retail level in 2003 was $322 billion US. So that's about a quarter of Australia's GDP. And that was 10 years ago. So it's a fair sum of money. I've only seen one estimate of the profitability of the drug trade, and that was a study that was conducted on behalf of the British government, and looking at a major drug trafficking ring in Afghanistan, and they estimated that profits accounted for between 26 to 58% of turnover. And I'm not really a commercial person, but I wouldn't mind running a business that where profit accounted for 26 to 58% of turnover. I think that the average figures are sort of 5 to 7% for many businesses. Are very happy to get that kind of level. So they're very considerable sums of money washing through the system. In 2012, Hong Kong Shanghai Banking Corporation, one of the biggest banks in the world, not the biggest, but one of the biggest, was fined the sum of $1.9 billion in the United States because of its involvement in laundering money from the drugs trade and also from terrorists. $1.9 billion. You shouldn't feel too sorry for HSBC. They have, I think their assets are something like $2.7 trillion. So it's it wasn't a big fine for an organisation of that size. They're colossal sums of money, and the whole system couldn't operate unless most of the lawyers and accountants and financial advisors helped them in their moving money around the world. And many of them, I suspect, would know that they are moving money around the world in large quantities. I'm told by a colleague of ours, that, of Nick's and mine, that one of the biggest problems that the drug traffickers face these days is getting money out of countries, because the money is in such huge quantities that it's so hard to shift. And many of you will have seen the photographs of the money that the drug traffickers have stacked up in rooms of this size, and it's stacked up 2 metres close to the ceiling, and it goes for rows and rows and rows and columns of it, 10 or 15 metres wide, and there's millions and millions and millions of dollars. Nick, do you want to comment?
No, I agree with everything you've said, and for the banks and the commercial institutions, just to be holding huge amounts of money means they can make profit, not without any criminal involvement, without doing anything much with the money at all. So yes, they do benefit incidentally. And the amounts of money just beg a belief, and it trickles down to the lower levels of the drug distribution chain. I remember a particular well-known colourful identity from King's Cross, I think, if I can call him that. His mother's house was raided out in the western suburbs of Sydney, and they discovered $1 million in the ceiling. And her response was, "How did that get there?" So, just a little example.
I'd like to ask a question to do with alcohol law reform. All of us who work with people, being myself as a psychologist, knows that alcohol has a much more devastating effect, a much wider devastating effect in the whole areas of sexual abuse, marriage breakdown, etc., etc. So I really would like, first of all, to comment about this latest legislation of the so-called killer punch and the very huge increase in the penalty. But also, is there any role for law reform in a positive sense that would help to help us in beginning, if you like, what might be an honourable war, and that's the honourable war against the misuse, the devastating misuse of alcohol. The change to the legislation was really the product of reaction to a media campaign. Now, in what I have to say, I am not being at all critical of the families of the young men who were killed or of anybody else involved on that side. I'm being extremely critical of the political reaction to all of that. And what we got when the then Premier, who's since departed, came back from his summer holidays last year. Yeah, well, he shot himself in the foot, I think, really. But still, he came back from holidays. There'd been this big media campaign, and
people had been very disappointed at the level of the sentence that was imposed on Kieran Loveridge for the death of Thomas Kelly. The sentence that was imposed was later found by the Court of Criminal Appeal to have been too low, and the sentence was increased by the Court of Criminal Appeal. That happened last week. And did anybody hear anything much about it? Not really. Did the shock jocks say, oh look, the criminal justice system works after all. The appeal process has given us a sentence that is proper. No, cut it out, exactly. So what the government did, rather than wait for that appeal to run its course and for the courts to adjust what was determined to have been an error, they rushed in to legislate. And the first thing that they legislated was to create a new offence of causing death by hitting. Now, I'm not being cute about that, that's the word in the legislation. By hitting somebody with part of your body or with an object. And not just once, you could hit somebody 100 times. You would still be caught by this provision. So it's not a one-punch death law. What they did, though, was to increase the penalty above what would ordinarily be expected for such an offence, governed by the offence of manslaughter, and then in certain circumstances prescribed a mandatory minimum sentence of 8 years imprisonment. What were the circumstances where the mandatory minimum would apply? Where the person was intoxicated. So what we've got is a scheme that has given us potentially a higher penalty for somebody committing this offence while intoxicated than would be imposed on somebody committing this offence while stone cold sober. Where's the logic in that? I think this is nuts. And what they did at the same time was to try to introduce mandatory minimum sentences for another 9 offences, subsequently reduced to 6, and presently lying somewhere on the floor of the Legislative Council, where I hope it remains forever. It's political populism, penal populism. It's reaction to a flash in the media. And for lawmakers to give us these draconian laws in such circumstances, I think is quite reprehensible.
Perhaps I could respond to the first part of the question. You're absolutely right. Alcohol is incomparably a far more serious health, social and economic problem than illicit drugs ever was or will be. It's a huge problem. It's hard to find a family in Australia that hasn't been touched by one or at least one of its members having a severe problem with alcohol. So it's a very common problem, and it causes a great deal of pain, misery and suffering. The irony is that we know pretty well what works to reduce the scale of alcohol problems around the world. And if you look up the literature yourself, or if you talk to people who do research on prevention across the world, there's a very high degree of consensus about what works and also what doesn't work. And what works is raising the price. You don't have to raise the price to huge levels, just a small increase gives a significant benefit. Less availability of alcohol, again, small decrease, worthwhile benefit. And you can reduce the availability of alcohol by having fewer outlets, shorter hours or more restrictive conditions. And we've gone the other way with alcohol in Australia in a big way. We've had a proliferation of outlets, and the opening hours have been extended drastically. So it's not surprising that we've had a lot more problems with alcohol. And then there are many other things that we can do. The road crash death rate has been substantially reduced in Australia, and sensible measures to do with road safety have largely targeted alcohol, been very successful. So the road crash death rate when I was a medical student in the 1970s was, early 1970s, was 30 per 100,000 per year, and it's now down to less than 5 per 100,000 per year. So 80% or so reduction in the road crash death rate. A lot of that's due to random breath testing, safety belts, removing rigid poles from next to the roads. So a lot of sensible things like that. We can make pubs like this a lot safer. Many ways. One way is to get rid of glasses like this, which are easy to smash and fashion into the equivalent of knives, and people with Y chromosomes like to do that for some reason. I'm not sure why it's only the people with Y chromosomes, but getting rid of these and replacing them with these is a good idea. Heavy furniture, and better still, heavy furniture bolted to the floor. It's a good, again, stops people with Y chromosomes getting drunk and throwing the furniture often at women. So there are many things that we can do, but the will to do them, and especially the difficulty of getting it through the political maze when the drinks industry is so incredibly powerful, is very, very difficult. We saw that demonstrated in 2014 in New South Wales. So the restrictions that Nick talked about, which should have been introduced statewide, were only introduced in 1 or 2% of the state. And they should really be covering the whole state. And I'm sure at some stage that campaign will start up again when we have more violence in the new areas. So it's a very important question. We had a Politics on the Pub a couple of months ago, last year sometime, where I was asked to speak on this issue. And I'm glad that you brought that up. Very important.
One question that comes to my mind, and thank you tonight for a very interesting discussion, is the other area which goes under the same name as drugs, which hasn't come into tonight's discussion, is the drugs in sport. And because it goes under the same heading of drugs, I would like your comments on the fact that drugs in sport are considered the ultimate no-no, and would to me seem a very severe restriction on trying to get the enlightened approach to what I might call the recreational drugs. Have you some comments to make that way? And particularly the way the drugs issue on the sporting teams is fuzzing along in the country at the moment.
Well, it's a very interesting question. I haven't studied it as carefully as I've studied the question of recreational drug use, but I've followed it to some extent. And I think that all the things that Nick and I have been saying about the problems with trying to enforce prohibition in the general community apply exactly in the same way with people who play sport. There are some differences, but really, if you think that it's futile trying to stop all kinds of psychoactive drug use in the community, the same logic applies to people who play sport. And you can drug test them every day of the week, and they'll find some drug that gives them a marginal advantage that there isn't a test for on the 10th of July 2014. And we saw with Lance Armstrong, who had urine test after urine test after urine test, unless he claims wrongly that they were all clean. Nevertheless, he managed to win 7 or 8 Tour de France titles, and then later on was forced to admit that he'd been using drugs all along, and somehow managed to evade the drug testing process. So where there is a strong enough benefit to professional sportsmen from using drugs that they think give them a marginal advantage, they'll continue to use them. The benefits of winning are so great that they will always find a way to evade the drug detection system. The question of fairness is raised. How fair is it of competitor A to use drugs when competitor B isn't using drugs? Well, there's some truth in that, but on the other hand, if an athlete trains at 6,000 metres when other athletes can only train at 1,000 metres and the competition's at 1,000 metres, haven't they got an advantage over the athlete who can't train at such a high altitude? So there are all these sorts of questions that come in, and also the athletes from the richer countries who have fantastic facilities at their disposal which aren't at the disposal of athletes from much poorer countries. So the more you look at it, the more you see that there are a lot of other unfairnesses that nobody gets terribly worked up about. Why get worked up about only one of these sources of unfairness? There's no level playing field in sport, and there never will be. So I think sooner or later the world sporting authorities and the community are going to have to face up to the reality that endeavours to keep sport drug-free are futile, just as they are in the community, and we'd be much better off trying to manage the system rather than try and achieve goals which are unachievable. Before I hand over the microphone to Nick, I just want to repeat one little anecdote. It's actually a letter that I read somewhere where somebody wrote in when there was a lot of fuss being made about the use of drugs by professional cyclists, and someone wrote into a paper and said, I've got a lot of admiration for the guys who are riding around being professional cyclists while they're using drugs, because when I was using drugs I couldn't even remember where I lived in bicycle.
That's a hard one to top. But I'll just make the one additional comment. The demand in sport will always be there. Because people want a competitive edge. If they see that they can get a competitive edge by using drugs, that's the way they'll go. And the supply will always be there. And you've got people like Lance Armstrong who takes a drug to mask that drug, takes a drug to mask the masking drug, and so it goes on. And human ingenuity is almost limitless. People will find ways of still using the drugs to get the edge and trying to cover up, just as happens in the community, I guess.
I was taught that alcohol was the worst thing ever to drink, and it was a legal drug. Now you're telling me that society wants to legalize cannabis, which I was taught was worse than alcohol. How does alcohol and cannabis, how can you put the two and two together? Like, both of them are bad. I'm just very concerned with the quality of the product. It's dangerous.
Thank you for the question. Well, there's no doubt that alcohol is a much more dangerous drug than cannabis. That's for a start. And that kind of judgment has been made by many different groups around the world using different ways of attacking the problem. And by every measure, alcohol is much, much worse than cannabis. Second part of your question, though, is really about the question of supply. And it's hard for me to understand why cannabis supplied by Al Capone is supposed to be safer than cannabis that's supplied with Tony Abbott delegating somebody to make sure that the quality of the drug is known and that the package has to have a warning label on it. This drug may give you schizophrenia, where there'd be a proof of age requirement so that it couldn't be sold to anybody who was under a certain age. And we can regulate cannabis in the same way we could regulate alcohol, and it wouldn't solve all the problems, but it should reduce a lot of the problems. We could do what Colorado is doing. The first $40 million of the tax raised by Colorado goes to rebuild schools in that state. So a lot of different ways can be used to approach this problem and make the drug less damaging than it is when it's supplied by the black market. What people don't realise is that the black market is a very pernicious system. It makes more dangerous drugs drive out less dangerous drugs. When alcohol was prohibited in the United States in 1920, beer disappeared and was replaced by wine and spirits. After alcohol prohibition was repealed in 1933, beer came back. And it's that same kind of phenomenon has been seen all over the world. When opium smoking was banned in Asia, opium smoking virtually disappeared, but was replaced by heroin injecting. Well, I think you get the general message. Black markets are really an even bigger problem than the drugs are themselves, and we're much better off where we can trying to regulate drugs that are currently supplied by the black market.
Thank you. So that concludes this session of Politics in the Pub. So let's thank both the speakers for their wonderful talk as well as their excellent answers for all our questions. There is another announcement just handed over to me. This is about the budget, building the fight to bust the budget. This is at 6:30 p.m. on Wednesday, 16th of July, UTS Tower, Broadway. So it's in UTS, it's on Wednesday, 6:30 p.m. And the speakers are Paul McHaleer and Matt Mager. So if you're free, please be at UTS 6:30 on 16 July, Wednesday. Oh, there's another one on the other. Oh, there are two here. Okay. The other one is an upcoming forum on hands-off public health. Yes. The truth behind the GP fee and the user-pays model, also related to budget, I guess. And the guest speakers are Ben Spice Butcher and also Jason Williams. And that's 6:30 p.m. on Wednesday, 6th of August. It's also on a Wednesday, but it's on 6th of August. The previous one, 16th of July. So please note it in your diary and be there. Thank you.
Yay.